In fact, the use of nanoparticles with laser for the skin was first tried with hair removal in blonde hair, because blonde hair doesn't have color and so lasers don't work on it. That was years ago with these carbon particles. It didn't work out. So that was not the best first attempt. But nanoparticles now are much more refined. They can shape them, they can coat them with different things. The size is a lot smaller in the micron range, so they can easily penetrate into the hair follicle and get down to the oil gland. It's more like a suspension. They take the particles and suspend them in either alcohol base or something, put them on the skin, use something to drive them in, whether that's a massager or in one case a vibrating paddle, and that just pushes the particles into what we call the infundibulum, or the opening of the gland. Wipe off all the excess and then use your laser. So normally the laser is not attracted to that gland. The sebum, if we call it the oil, is just not a chromophore, we call it, for laser because of the color. So what you're doing is you're basically adding an artificial chromophore. In this case, it's a particle. But these are metal nanoparticles, silver or gold. So they don't explode like you would think with melanin or blood vessels or heat up. They heat enough they start oscillating and moving. And when they move, that generates heat that we call plasmonic resonance. That heat is what destroys the gland. So it's a secondary process, but without that particle, it wouldn't happen. Right now, the protocols are being worked out in clinical trials, but typically it's a multi-treatment thing. I would say 3, maybe 4 treatments. The hope is that it will result in some destruction or disabling of the sebaceous glands, which will give us a longer lasting improvement. I think that's the way, that would be the advantage. It's still in pivotal trials, and as you know, the FDA is pretty rigorous. It's an interesting time. You've got competing companies using competing technologies with, as you mentioned, gold and silver nanoparticles, and both of them have their pros and cons. Hopefully with the FDA data, when it comes to the pivotal trial is complete and all the data is analyzed, we may very well find that both of them work just fine. The other thing is that it depends on the laser you're using, so some of them can use one wavelength, some of them can use another. So the hope is to have, if you have a laser in your office used for hair removal or something else, that'll also be something you can use for acne down the road. The longer the wavelength, for example, if you're using maybe we call it 1064 nanometer wavelength as opposed to a diode or a 810, you could. And it also depends on the energy. But we know adolescents that would be getting these treatments, especially boys, right, are pain sensitive. So it may be that you need either some ibuprofen, or it may be that you need a topical anesthetic down the road, depending on what you use. The studies that they've had to do to get to a pivotal trial, one of the things they had to do was show that there's no tissue accumulation of these, and there isn't. So either they get excreted, by that same sebaceous process, or they do get destroyed in the thermal process. But they don't exist in the blood serum, and they don't accumulate in tissue. And this has been found in animal models to be the case. They had to get to that point before they got to a pivotal trial. The other aspect of using gold, of course, was in arthritis. And gold was a medication used in rheumatoid arthritis for years. But it was oral, and the doses were way higher. And those people that got gold therapy for arthritis, it's interesting, you cannot use lasers on them for certain things, because, for example, tattoo removal, or you will cause discoloration of the skin as soon as that laser hits the. But again, that was oral gold, much, much higher concentrations, and that did deposit in the tissue. This is a whole different process. The hard part is going to be once these prove efficacy, and I believe they ultimately will, it's just a matter of getting the delivery system. How do you charge for that? How do you reimburse for that? That's going to be the question. I have a feeling to go down an insurance reimbursement pathway is going to be very tough.
Yeah.
It may very well stay in the cosmetic realm, and you do your medicines, your orals, and your topicals, and all this stuff. And then you might use these for patients who really want something quicker.